Now to a COVID warning ahead of the holiday season. Health officials say we could see another wave of infections this winter, and they're urging Americans to get those targeted boosters before Halloween.
Well, one man who knows just how important those shots are is Pfizer's own CEO, Albert Bourla, who had COVID not once but twice just since August. He sat down with CNBC anchor and New York Times columnist Andrew Ross Sorkin, who joins us now. Andrew, let's play a little bit of that conversation. Interesting to see the head of Pfizer stricken with COVID not once but twice, but let's roll the sound and we'll talk about it.
When I got it, I was actually in UK, and I spent 5 days in the hotel. It was very light in symptoms, and I took Paxlovid again, and so I became negative in 2.5 days. I just had to stay in the room for 5 because that was the rule.
And how are you feeling now?
I feel very good, very good.
And were you surprised? I mean,
I was
within
surprised.
2 months.
Probably, if I have to take a guess, it was a the new strain. And when I got it back in August, it was the old strain of Omicron.
Pharmaceutical CEOs, they're just like us. They get COVID too. But so he thinks this is actually some new subvariant that he got, and that explains how he got it twice?
That's his explanation. But of course, you know, when the CEO of Pfizer, the largest maker of vaccines, gets it and gets it twice in under effectively 2 months, lots of questions. There are questions about mandates and vaccines and free speech, and all of those things were raised in this conversation that we had. In his mind, he thinks, not just in his mind, he thinks because he had gotten the U.S. originally, he believes that was Omicron. He believes that what happened to him was he went to the U.K. and effectively got this new variant, and would argue that this is why we all need to get boosted. He was unable to get boosted because if you remember, you're not supposed to get the booster if you just had COVID.
Right. So is that new booster effective against this new strain? Do we know that yet?
So it appears that the evidence suggests it is effective against death and real disease, right? And that's the issue. The question, of course, is how much does it help with transmission? And I think one of the things that he worries about as somebody who has been boosted and vaccinated, not, of course, this new booster, do people say, I don't really need it? Now, right now, unfortunately, only about 13 to 15 million people have actually taken this new booster. There was a time in America where people were getting boosted and getting the vaccine, 4 million people a day. Right. And so there's a lot of work to be done.
Yeah. All right. Well, thank you, Andrew. You can see the full interview during the first episode of Special Edition, Wednesday night, 10:30 on NBC News Now, or you can catch it on demand on Peacock, YouTube, and NBCnews.com. A lot of ways to watch.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.